Today we're going to talk about wheezing. What is wheezing? Wheezing is like a whistle inside your chest, and sometimes it's easily confused by coarse noises in the chest or rattling, but that's not necessarily wheezing. What wheezing is like wind going through the creak of a window.
Well, there's an old saying that says not everything that wheezes is asthma, which is true, because wheezing is that noise that we hear when there is narrowing in the small airways. So whatever causes that narrowing, which includes bronchospasm like asthma, or secretions like some infections, or even fluids like congestive heart failure, you may hear that wheezing. That's why when a patient comes to me, I do a detailed history which will tell me what's the next step that we need to do and what's causing this wheezing.
What the symptoms that occur are wheezing, that squeaky sound that people have when they breathe in and breathe out, especially during exercise. Some people might have coughing or a chest tightness during exercise with exercise-induced bronchoconstriction. So if those symptoms are going on, it's important that you see a sports medicine physician or your medical provider so they can evaluate your lungs. If you're diagnosed with exercise-induced bronchoconstriction, or EIB for short, you might be prescribed an inhaler. An inhaler is commonly known as albuterol. That is something that can help open the airways as you exercise. You'd also want to have the underlying trigger treated. If it's environmental allergies, you'd want to be on allergy medication and/or nasal spray for that. And you want to avoid environmental triggers if that's what's triggering it. But certainly, exercise-induced bronchoconstriction, or EIB, can be controlled so that you can get back to running and back to your training path.
About how to stop wheezing. Okay, so firstly, what is wheezing? Well, it's a high-pitched whistling sound that you usually get when you're having to breathe through narrowed airways. And why do you get a wheeze? Well, the most common reasons for wheeze would include things like asthma or having a viral infection, which can induce a wheeze, especially in children. You could have, if you're perhaps a little bit older or you've been a smoker in your life, chronic lung disease, chronic obstructive airways disease, emphysema, or chronic bronchitis. Or there may be another cause. So if you are experiencing wheezing, you must go and see your own doctor for a definitive diagnosis as to why you have your wheeze. So if you do have asthma, obviously an inhaler is the best way forward to reduce the wheeze that you're getting. If you're experiencing shortness of breath or chest pain, or your wheeze is not responding to your inhalers, you must go straight away to seek medical attention. Now, if you do have asthma and you want some general advice about how to reduce your wheezing as well as using your inhalers, you could try a few things. The first thing to suggest is to avoid any triggers that you might have for your wheeze. Some people with allergic type wheeze have it brought on by exposure to certain allergens, house dust mite, maybe some sort of family pet. So it's worth looking into whether one of these could apply in your situation. Other things you could do is avoid smoke. Obviously, you do not smoke yourself, you should not smoke. And if you do smoke, go and see your doctor to try and reduce your smoking habit. Sudden temperature changes can sometimes make someone with asthma prone to wheeze, so something like going suddenly into cold air may be a factor that contributes as well. Dust, pollen and other things like that can also contribute, so try and avoid them where you can. Sometimes a warm caffeine-based drink can help to open up the airways as well, so you could try that if you want to. But the most important thing that I want you to take home from this video is that you will need to have some sort of inhaler if you're suffering from wheeze, so you should visit your own doctor. Good luck.